All right, I think we are in business. Sorry about the delay, everybody. This is Dr. Patel. Welcome to my Facebook Live. 20 minutes late. Come on, that's not that bad. You waited longer for a doctor's office before. Hope you all are doing well. Today we are going to be talking about hip pain, and specifically we're going to be talking about the anatomy of hip pain. So what is the anatomy of the hip, and what are the different things that can cause pain in different areas? But before I get started, if you are interested in hearing different things, or if you have some questions about this topic or other topics, please feel free to comment, DM. You can email us at info@fxregencenter.com. If you like this video, please like, subscribe, all those fun things. And you can catch up with all old videos on Facebook, but also on our website, www.fxregencenter.com, or on our YouTube channel. You can always look us up by searching for Regen Dr. Patel. So, hi Kathy, thank you for joining me. And thank you everybody for those that are watching live and for those that are catching us on our website or on YouTube after the fact. So without further ado, we're going to talk about the hip. And I've talked a little bit about the hip in the past, but I'm going to delve a little bit deeper into the hip. In the past, we've talked about things like hip pain and the hip joint, as well as the various different musculature, soft tissue structures, etc., that are around the hip that could be causing issues. We've talked a lot about in the past a pain in the butt, and pain in the butt that could come from the hip or other structures. But I'm going to go through a little bit more in depth about the anatomy of the hip, and I'm going to explain a little bit about what your typical hip joint pain is, as well as other pains that are surrounding the hip area based off of the anatomy. So first and foremost, I'm going to start drawing some stuff, and we're going to kind of go through what are the different things that could cause hip pain. So bear with me as I go through these drawings here, but let's see, I'm going to use a little bit of a smaller thing. So here is your spine, and I'm going to call this your lumbar spine. Here is your sacrum down here, which is kind of like a triangle. And then you have your pelvis that sits here. That's what it's going to look like today. And then you have your lower leg bone, which is called the femur, that goes to this kind of ball over here. Now, this is as if we're looking straight at your pelvis over here. For completeness, we'll put your ribs over here too. Hey, look, this kind of looks like a full-on skeleton now. There you go, right? Now, when you look at this, what are the different things that we see? Your lumbar spine, or your low back over here. We see your sacrum, your pelvis, which is what a lot of people consider your hip, and then the actual hip joint, which is this kind of ball and socket joint right here. Now, when people typically talk about hip pain, a lot of folks talk about pain that's in the buttock area or on the outside of the hip. So when people talk about hip pain, they're usually saying things like pain in this region over here. But in actuality, the hip joint is actually in this area. And when we think about where that is in our body, that's actually in our groin. So if we look at the whole body here a little bit more, right? Here's our skin now. And here are our legs. So this area over here is where people typically say they're having pain, which actually is outside of the hip joint. And the hip joint itself is actually kind of in this region, or the crease of our hip groin. And if we kind of try to picture that in terms of where our clothing is, right? Really, we're talking about something like where your, tighty-whitey or bikini underwear lines are, is where we're talking about in terms of where the groin is. So it's in this area where the line of your underwear is actually the region where we feel true hip pain. Now, what is it that's on the outside over here if it's not truly the hip joint? Well, that's the area that we actually have some various different muscles, okay? Let's say muscle's gonna be this color today. So we have muscles of our buttock area that actually come from the back of our body, back of our buttock, and come and attach out here. This area here, this part of the bone, is called the greater trochanter. That's that kind of bone that we feel on the back of our, on the side of our hip. And there's several different muscles that come and attach there. Some of these muscles include things like your gluteus medius and your gluteus minimus, which are the strong buttock muscles that are on the side of your buttock. We have other muscles that attach there as well from the back of your buttocks, and I'm going to get to that once we turn this hip model around. We'll go over the muscles in the back area. But there's a lot of different musculature that's kind of all over the place, and when the muscles are not firing properly, those muscles can become pain generators as well. And where the muscle attaches to bone, which is called tendon, that's an area that can very typically cause irritation at this greater trochanter. And that's called gluteal tendinitis or gluteal tendinopathy or greater trochanteric pain syndrome. A lot of people think of pain on the outside of the hip as what's called bursitis, which is an inflammation of a fluid-filled sac called a bursa. Now, bursa is really just a pocket of fluid that protects areas where tendons come and attach onto bones. So this area over here, there are some bursa that sit over here, but it's actually less common for us to have a bursitis than we recognize. Now that we have things like ultrasound where we can take a look and see what's going on here, we realize that it's not actually necessarily a bursitis or inflammation. Rather, it's irritation to the tendon fibers that connect over here that could be causing pain. So when we think about different areas of pain, we have the groin, as I mentioned. Oh, sorry. Let's see. The groin, as I mentioned, is a very typical area of hip joint pain. There's the outside of the hip, which could be the greater trochanter, bursitis, tendinopathy, etc. There's the front of the hip region into the thigh and on the inside of the thigh. So I'm going to call that the front and inside. And then we're going to talk about the butt. Right? So in the groin area, as I mentioned, we have the hip joint. But we also have other muscular structures like the hip flexor tendons. The hip flexors are actually two sets of muscles. The iliacus that comes from the inside of the pelvis, as well as the psoas that comes from the lumbar spine. And these guys come together to form the iliopsoas tendon that actually comes and attaches down here at an area called the lesser trochanter. And these tendons can get irritated and cause pain in the front of the hip as well. If you ever have snapping or clunking occurring in the front of the hip, then that could be associated with this tendon not rubbing properly along the bone. But you can see how that tendon goes right over where that ball and socket joint is. So we have to be very judicious in figuring out, is this pain coming from the joint or is this pain coming from the tendon? But that's certainly something that we need to consider. So your hip flexor muscles and tendons are something that can cause pain in the front as well. There are other muscles also. There are muscles that come and attach over here and go down the leg. There are muscles that attach over here and wrap around the leg in various ways. So there's a lot of different guys that can get irritated or injured in the front of the hip area. So in addition to your hip flexors, you have other muscles and tendons in these regions as well. And then finally, we have things called nerves that come from the low back region. And from the upper area of the low back, we have nerves that cause pain to radiate into this region as well. So whether it's pinched nerves that are in the low back or nerve irritation in other areas of the hip, all can cause symptoms into the hip region in the front groin. So on the outside of the hip, again, we talked about the gluteal tendinopathy or greater trochanter pain. So greater trochanter, I'm going to say that's GT and tendon, right? But the other thing, again, nerves can cause irritation to that area as well. So lower down the nerves, L4, L5, S1 can cause pain to go down the side of the leg, including just to the side of the hip. This is starting to get real messy, but you can see how there's a lot of different things that are in these areas. And then finally, when we talk about the front inside, or this area over here, there are a lot of other structures, such as muscles that come and attach onto the pubic symphysis over here, which is this bone where the pubic bones meet. And these are called your adductor muscles. And these adductor muscles are in charge of bringing your knees together when you're sitting or standing. And those muscles can get irritated in this area. And this is typically an area that's felt more towards the pubic bone. And there's a lot of different conditions and terms that are associated with that. Everything from sportsman's hernia or sportsperson's hernia to pubic symphysis pain, to adductor tendinopathy, to even irritation to the muscles of the abdomen. Your six-pack muscles come and attach over here as well. And likewise, this can actually kind of refer pain throughout the groin area. So you can imagine how this front inside pain can actually have a lot of muscle tendon stuff that actually goes back and forth between the groin and the front inside of the leg or the hip. And then finally, with buttock pain, again, we have a lot of different muscles that are back there, and I'm going to draw out some of the muscles in a second. But there's a lot of muscles and tendon things that go there, as well as your typical kind of sciatica or pain coming from the lower aspect of the lumbar spine can also certainly cause pain into the buttock area. Now, what's fascinating about all of this is that the hip joint, even though we typically think of it as in the groin, there's studies that now show that hip joint pain can be all over the place. So hip joint pain can be in the groin area. It could be on the outside of the hip. It could be in the back of the hip or the buttock. It could travel down the thigh. So hip joint pain could be all over the place. Sacroiliac joint pain, which is the joint between the pelvis and the sacrum, that can cause symptoms into all of these areas. And of course, nerve irritation, nerve pain can cause symptoms into all of these areas as well. So you can see how messy this could all really get. Now, I'll show you what could be even messier is all the different musculature that we actually have in the back of the hip. So if you have butt pain, not all butt pain is butt pain, right? You have your lumbar spine, if we're looking at the sacrum from the back here. And when we have your hip on this side, ends up having a lot of stuff going on. And this is going to be my crude hip anatomy here. Again, your femur and your thigh bone on this side. And now we're looking at your buttock from the back, okay? Well, here we have a lot of different muscles. We have the muscles, the gluteus medius and the gluteus minimus that come off from the side of the hip and attach on the outside, the greater trochanter. You have this guy called the piriformis that attaches at the bottom or back end of the sacrum and comes and goes all the way down to the greater trochanter. Then you have a bunch of muscles that are kind of like the rotator cuff of the hip that come across the back of the joint as well. And convoluted within all of this stuff, you have a web of ligament structures that connect your sacroiliac joint to your low back. This web of ligaments goes down to your ischial tuberosity of the pelvis, and then this web of ligament structures that are connecting everything actually then are continuous with other structures such as your hamstring muscle tendons that come and attach over here as well. And mixed in between all of this stuff are your nerves that come from the low back and create the sciatic nerve that travels underneath, through, or over your piriformis and travel past all of these muscles to then go down the legs. So this is even more of a complex area, arguably, than the front of the hip, with all of the different various muscles, ligaments, nerves that are going on back here, all overlying that hip joint that's deep inside. And really, irritation to any and all of these structures can be things that cause pain. So how do we figure out what exactly is going on when we have a situation like this? Well, this is why it's really, really important if you have pain in your butt, pain on the outside of your hip, pain on the inside of your hip, your groin, any of these things that is persistent for a period of time or that is recurrent, that's coming back frequently. Well, it's super important for you to see someone that can do a thorough physical examination and perhaps combine that physical examination with advanced imaging such as diagnostic ultrasound, X-ray, or MRI to see exactly what is going on. These imaging modalities can help with actually peering inside your body and seeing if there's any damaged muscles or if there's any potential pinched nerves in the low back or arthritis in the hip or tears to ligament soft tissue structures like the labrum or various different things like that. But a lot of these things can have, degeneration or damage on imaging, but may not actually correlate with your symptoms. So a thorough physical examination is important to figure out, all right, what exactly is actually causing the pain? And beyond that, we need to even look not only at what's causing the pain, but also what's structurally, what's functionally involved with the issue. So for example, if somebody's having pain in the front of the hip and they're starting to develop some arthritis, but they have weakness across the buttock, well, what's causing that weakness in the buttock? Is it the fact that we have the hip arthritis, or is there an issue with the muscle or tendon, or is there an issue with the nerve? And putting all those pieces together is what we need to do in order to get the most comprehensive treatment for the hip pain condition. Because we could do something like a cortisone injection into the hip joint to decrease the pain, but if we don't deal with the underlying mechanical or biomechanical issues, then the cortisones are going to last X amount of time before that hip joint gets angry again. So really important to put together all of this information. And even then it could be challenging to figure out what's causing hip issues. So those are the circumstances where we may want to consider additional diagnostic things, such as even what are called diagnostic injections. So if you think that something might be causing the pain, but you're not 100% certain, using some image guidance to get a needle directly at the thing that's causing the pain and putting some numbing solution might actually be able to tell us, all right, how much of the pain is coming from those structures? And that can help us determine, all right, what exactly is the pain generator? And sometimes it's a matter of just treating that pain generator and we can get significant relief. Sometimes we need to treat other pieces of the puzzle as well. And by doing that, we can really get long-term benefit. So Kathy asked, is it more hip when sitting and feeling the pain in the booty, hip, and down the side of the leg to the knee? It's a great question because that's just another pattern of pain that we see so frequently. Pain in the butt when you're sitting, pain kind of going down the hip or down the side of the leg, can be a referral pattern from irritation of things like the tendons that come and attach over here. One structure that I did not talk about is what's called the iliotibial band, which is actually a soft tissue ligament structure that goes down the side of the leg, and it actually comes from two different muscles. One, the big gluteus maximus muscle, which is the big buttock muscle on the back of the hip, and one smaller muscle called the TFL that's in the front of the hip, come together and form this iliotibial band that goes all the way down to the side of the knee. And I feel bad for the iliotibial band, actually. Iliotibial band, I'm weird like that. I feel bad for random muscles and ligaments. I feel bad for the iliotibial band because it's oftentimes blamed for pain going down the side of the leg. And people say, oh, my IT band is tight. And there's all these stretches and foam rolling and things to loosen the IT band. But interestingly, it's oftentimes not an issue with the IT band being tight, but it's actually an issue with the glute muscles being weak. And not just the glute max, but also the side of the glute muscles, the gluteus medius, gluteus minimus. When there's a dyssynergy, when the buttock muscles as a whole, as a group, are not firing in sync with one another, then that can cause that perception or feeling that the iliotibial band is actually tight, when in actuality it's the muscles that are weak and not the ligament that is tight. Because that's why you foam roll your iliotibial band, but then the symptoms keep on coming back. Well, that's because there's an underlying issue that's not been addressed. One of the other things that causes that perception of iliotibial band tightness is actually nerve irritation in the low back. Because pain going down the side of the leg is a very common distribution of nerve irritation, particularly the L5, but also other nerves. So there's a lot of things, and if we feel pain when we're sitting, and pain in the buttock, in the hip, going down the side of the leg, if that sitting position is putting us in a position that's causing irritation to the nerves, that might be a very common culprit that we see in situations like that. Versus, Kathy also asked about, hip pain when you're walking. So hip pain when you're walking can be very different than hip pain when you're sitting, right? Because when we're walking, now we're activating our various muscles. Not only are we activating muscles that are important for our stride, but there are muscles that are literally activated in order to keep us upright. And the pattern in which we're walking can actually give us information as to what may or may not be going on. So there's various gait patterns that we can look at to see, all right, are we walking in a way that's actually because some of our muscles are weak? Are we walking in a way that's causing pressure into our groin or our hip joint, right? So these are the things that can certainly contribute to pain when walking. It really comes down to pattern recognition and doing a thorough examination of what exactly is going on when that walking is taking place that may be causing the pain. Pyle said, so informative, I need to strengthen my flutes. I think you meant glutes. But yeah, I think glutes are one of the things, and again, not the gluteus maximus, but the other muscles of the glutes, the gluteus medius, the hip external rotators, that rotator cuff of the butt. Those are the things that are so important to strengthen, and that I think that we oftentimes neglect because we're focusing on things like squats and deadlifts and things that are looking at our posterior chain, which are still important, but we oftentimes neglect the muscles on the side of our buttocks, which could actually be really, really important for the hip region in general. So, all in all, I think there's the takeaway that I want you to take from this, and I'm going to go into the anatomy more in depth, strictly speaking about the anatomy more in depth in a future episode. But the takeaway that I want you guys to appreciate from today is that, first of all, hip pain is not hip pain is not hip pain. The hip joint can cause pain in a lot of different areas. Your textbook hip joint pain is in the groin, but it can cause pain in other areas as well. But there's a lot of other structures. There's soft tissue structures, ligaments, the labrum, muscles, tendons, nerves. All of these various different structures are things that can cause pain in the various different hip joint regions, right? The groin, the inside of the hip, the outside of the hip, the buttock area, all of these areas are things that people consider the hip. So it ends up being super important to, when you're having these symptoms on a regular basis, it ends up being super important to take the time to actually figure out what exactly is going on. And not only looking at what the pain generator is, but taking that step back and looking at the whole picture, seeing what our biomechanics are, and seeing what are the different things that are going to be contributing to your hip pain. I hope that all made sense. My drawings were pretty messy today. But I'm going to blame that on the fact that the hip is a complex and messy place. So I hope that all made sense. If you have questions about what we talked about today, and of course, if you have any questions about any other topics, then please feel free to reach out. If you have other topics that you want me to talk about, we're always open to suggestions, always looking to talk about different things. So reach out via DM. You can comment. You can email us at info@fxregencenter.com. If you like this video, please like it, share it. Spread the word that we're here for you. And that's really all I got. So hope you enjoyed. Have a great weekend. It's going to be an exciting weekend. We got the Super Bowl. We've got Valentine's Day. Hope you all enjoy. Stay safe, stay merry, and we will see you next week.